to our practice. It's
Thank
such
you.
a pleasure to have you here today. And I know that you are an absolute expert in your field of mental health in terms of neuroplasticity, in terms of what can actually be done on a daily basis to actually ensure a better mental health, which is going to impact on every aspect of our lives. I know that most people, if not everyone, are very uncomfortable actually.
I think we need to talk about that one right now.
Sitting in this chair. So
It's like,
how do you feel right now?
oh my word. Okay, so this chair is a trigger for me. And I think it definitely goes back to the time when I was young, and the dentist visits that I had then were I can't ever remember a great dentist visit. The only other dentist visit that I can remember that was like different was last year when I went for my my dental checkup. And
I'm sorry that
yes,
dentistry and dentistry are so close.
I'm mental right now, let me tell you. So the brain comes everywhere. The brain goes everywhere. The brain goes to bed. The brain goes into marriage, and the brain comes into a dentist's chair.
Into my dental surgery.
Yeah. So.
May I just hold that for a moment?
Yes, you may. Most people have got one of these.
Yeah. I just want to see what mine looks like. So
yeah, it's a little bit bigger.
Yeah, it's absolutely critical that we remember that when our patients come and see us, that we're not just dealing with the teeth, but we're actually dealing with the whole person.
That's it.
Every person has one of these.
Yeah.
And it's so important to understand what's actually happening in this area while you're actually sitting in the chair.
So the brain itself, the brain doesn't think, the brain doesn't have emotions, the brain doesn't have questions, the brain literally does nothing except facilitate. So it's like a trampoline on which the DOS program. So what's inside that brain is our consciousness. So that's the conscious consciousness is where the neuroplasticity.
If I may just interrupt, because this is fascinating. You're telling me that the brain cannot think.
Yeah, it's simply a mechanism. It's hardware. So it's like a computer. Your computer and my computer, laptops that we've got, are as dumb as the day that we bought them. What makes it intelligent is when you get behind it and you start going, this is what I'm wanting, and you interconnect all the different programs.
So where does my input actually come from then, if it's not coming from my brain?
So it's coming from the neuroplasticity. So the neuroplasticity is how our consciousness creates thought. So there's a little space in our consciousness called knowing. It's like a circle with dotted lines.
Yes.
And whatever happens to it. So I'm now sitting here in the chair and my neurology has got I got 8 languages, how the neuroplasticity stores and works with information.
Yes.
So it's visual, it's sight, it's auditory, it's taste, it's smell, which is another trigger for me in dentistry.
So how does the smell become that trigger?
I'm going to tell you all about that one, doctor. I'm going to tell you all about that one. So it's see, hear, smell, taste. Then there is kinesthetic. So kinesthetic is an energy within an emotion within my body. So within the biology of my body. So I've got that's why my toes cringe when the drilling starts.
Oh my goodness.
So that's the moment. So and I'm also touch orientated and smell orientated. So the moment I smell that burning tooth, And I don't know what they're supposed to do, put more water in or whatever. So the kinesthetics is a combination of hearing, smelling and tasting, which is all happening in the mouth at the same time. And then you have vestibular, which is another language. The vestibular is like the internet of our mind. So I don't talk about the brain, I talk about the mind. So we are our mind. And it's our mind that does the thinking and the feeling and the expression, etc. So while that little knowing circle is being impacted by reality in this chair, all of this is firing at the same time. So my neurons are running around going to get old memories, and they go and call all the old memories of Dr. whoever it was when I was 15, 16 years of age, when they used to pump you with, what was it, lead that they put in your teeth?
Well, the fillings contained mercury.
Mercury,
Yes,
okay, that's what. So, and then there's the other language called meaning. So meaning is where I work as a neuroplastician practitioner, to be able to unpack the mind, that when a person comes and sits in this chair, it's not triggering them anymore. So you go into a change of, I can literally change my mind around what I'm going to feel.
So you can actually help somebody who has literally
Fear,
a phobia,
yeah.
a phobia, even more than a fear, a deep, deep-seated phobia of dentistry and visiting the dentist. You can, by a neuroplastic approach, you could help them, assist them, facilitate that journey to actually get over that.
Yeah. So one of the things, and I'm talking about myself, where I create tension, nervous tension, is when my mouth is open for long periods of time. And it's automatic how the body teaches you, going, I wish I could just tell somebody just to stop what they're doing, that we could just massage here, because it's like these muscles are constantly being pulled down or forced down.
Yes.
And I've got to keep my mouth open all the time. So the fear that one has is a combination of what happens in those 8 languages, how they dance together.
Yes.
So when I taste and I smell, I'm going to taste the antiseptic or whatever goes in the mouth first before they inject the little prick. I'm going to feel that the numbness within itself is, for me, it's almost like a ambivalent thing. I'm numb, and then I hear the sound. You know, that the 2 sounds that I hear, I'll make them now. The one is that one like goes right up into my brain, and then the other one is when you change the drill bit to that one that goes, and that like vibrates. Even the apples of my eye vibrate in that process. So it's being able to handle that in a calm state. So breathing is critical. So breathing in deeply through the nose, breathing out the mouth, breathing in through it. But then you've got like 7 things hanging out of your mouth at the same time. And the dentist asks you questions after they've injected you, going, how are you feeling? And you go, it's like, this podcast is turning out like a comedy show. But
it's very interesting, Bill, because you're describing, and forgive me for smiling, but your impersonations of my, or should I say, of the dentistry drills. Well, the high-pitched one is the turbine that literally runs at an incredible speed, and the one that makes the vibration and the slower pitched noise is generally an electric motor, which allows the dentist to finish the restorations or the procedure with a lot more tactile feedback and therefore accuracy. But it starts that fear a lot earlier than actually just coming in here. Because how do you feel when you phone to make the appointment?
I think that's why most people hesitate to make the appointment, because we kind of know what's coming. My wife went to a dentist yesterday, and they said wonderful teeth, etc. But for her, the discomfort came when they had to do the cleaning and to get rid of the plaque. That was there for last she saw the dentist was 2 years ago, and that was uncomfortable for her. But it was. She said it's necessary. I had to. So there's a logical side to it that you need to engage with at the same time. So I know I need to see the dentist a minimum of once a year for a checkup, preferably twice a year, so that I'd be able to get that right. So from picking up the phone and making the appointment, the second call is not as bad as the first one, because you've got a relationship with the dentist. So if I've gone to a dentist once and I've had a good relationship with that dentist, and minimal pain, but there was discomfort because it feels different when you're cleaning the teeth and removing the plaque and all the high pressure hoses that go into your mouth and all that kind of stuff to get out whatever you've got to get out, because you didn't floss and because you didn't brush your teeth with a soft toothbrush and you went for the hard one and you're busy brushing your gums away. And I still can't find the rationale of why a factory would create hard toothbrushes or medium toothbrushes when we know the reality your teeth need soft toothbrushes. So what's the deal going there? But it's all marketing and it's all sales and it's all money. It also is a tactile thing, because I used to feel when I used a medium brush that, okay, I've done a great job now. I've cleaned my teeth, but I didn't brush in circles. I brushed like that. So I was merrily brushing the gums away, yes, and the sleeves, which are critical. So you told me about a sleeve, that if it's not tight around the tooth, bacteria can't get into it. But if the sleeve is loose, then all the bacteria goes in there, goes down to the roots and creates havoc and ulcers and whatever. But I think that, so the way I would work with people in counseling them is take them frame by frame, because that's how the mind works. So the first frame is, okay, I either get the message on my calendar, it's time for the dentist visit. The next frame is, I'm now going to have to phone, or someone phones on my behalf. If I have a relationship with the doctor, I'm happy with that, so I'm not stressed. If I don't have a relationship with the doctor and it's a new one, then I already crunch my toes on the phone call, because it's like, okay, and they don't say, are you okay? Are you relaxed? You can breathe. So I think dentists need to also give themselves permission to coach, because that mind is in the chair now.
Yeah, this mind is actually
it's
with
active.
us the whole time.
It's there all the time. Nothing that happens from the moment I park to the moment I'm in the chair.
Yeah. Well, so this brings us to a very important point, and it enforces the fears and the phobias that our patients genuinely have. And that is because there is such a negative connotation about previous visits and previous pain and previous discomfort. And you've so beautifully unpacked that for us, that many patients, in spite of having some pain or some discomfort, will not visit the dentist for 1, 3, 5, 7, even more years.
Oh, and they pay the price for it.
And the issue then is that a very real problem exists, because problems that could have been identified at a very early stage and preventative therapy or management initiated at low cost, low trauma, low time needed, become expensive, invasive, and very lengthy processes. Yeah. So it's so sad and such a tragedy that the fear and the phobia is actually, unfortunately, making everything worse, because it prevents you from actually coming to us at a much earlier stage and us having a much simpler solution.
Yeah. So all so a phobia is locked within the neuroplasticity. So the neuroplasticity is how the conscious mind thinks, creates a thought, how the conscious mind creates a question, how the conscious mind creates energy. So the moment there's negative energy, there'll be a negative emotion. And then that then creates a negative conclusion, which in turn turns into a decision, a cognitive decision. So if the conclusion is, I'm not enjoying this, the conclusion is, make a decision of extend the time. So that's delay it. So they delay it.
Yes.
But as you say, in the delaying, we forget. So the brain comes to the dentist, the conscious mind comes to the dentist, but biology also comes to the dentist, reality. So in my mouth, there's 100 million bacteria. It's moist, it's wet, it's the biggest cavity in my body. And everything happens here for good or for bad. So it's the way I treat it.
It is the gateway to the body.
Yes.
And so what happens in our mouth not only fuels us, hydrates us, energizes us, but the status of the health of our mouth has a direct effect on our entire bodies, from our brains all the way down to the bottom of our feet. And maybe you would just like to unpack for me, please, how we could reach our patients and patients out there in terms of understanding that it's absolutely critical to get to their dental practitioner or to their specialist prosthodontist, periodontist, surgeon when they have a problem. How do we practically do that?
It's relationship building and it's education. So it's a two-prong approach. So there's got to be, like you now doing on short videos, etc., educating people and going, let me get to my customer database. So all your customers are going to listen because they had a relationship with you, and my relationship with you is one of total, you can do what you like in my mouth. I trust you. So that's the big thing.
Yeah, but now those patients who've been to their practitioners, you've been to me before, that relationship is there. But for someone who hasn't been for 1, 3, 5, 7 years, there is no relationship. And so I'm sure that's also a factor that negatively impacts their neuroplasticity and their brains, because they cannot draw on that positive relationship to help them. So how do we and how do you get over that?
So the longer, so in coaching, I'm an executive coach.
Yes.
So when I coach people, the maximum time span is 17 to 20 days. The moment I go over that and they're going, I'm too busy, I'll see you in 30 days' time.
Yes.
We have, it's almost like I have to reintroduce myself.
Yeah.
So what happens, that then goes into the memory.
Just after 17 to 20 days.
Yeah. To keep the coaching going all the time. Because
it's a very, very short time period.
Yeah. Because if you, so that's when I'm coaching people that want to change their business. They want to scale up. So then we need to bring the time scale closer. If they just want to go to maintenance, then the time scale goes to maximum about 30, 32 days. And what happens then is the experience and the trust with their dentist that they had, whether good or bad, goes into a memory, and it's remembered with all 8 languages, combinations, goes into the memory. Now when I either have a pain in my tooth, or I've realized I've got an abscess or pain in the gum or wherever, that memory is now recalled, but it's a memory from the past.
Yes.
So I now bring up the past and I'm reliving the past in my mind.
So the mind has the capacity to make the past actually real at the moment.
Yeah, no, it just makes it reality right there and then. So even when you do a to-do list, the stuff that you didn't finish yesterday, you bring it into today. You bring in the negativity of the mindset, the reason why you procrastinated with that item that it didn't finish. So all you're doing is you're bringing the past into the present. So you've got to rethink,
Yes.
consciously rethink around it. So the education needs to be around, okay, let's educate our patients now that when you're preparing for the next visit, there's a few things you need to be paying attention to.
And before we get on to that, it's also in terms of preparing ourselves, in terms of health practitioners, in terms of we're not just treating the teeth, we're not just treating the appendix, we're not just treating your hand. It is part of a person. And you cannot separate one part of a person from the rest of that person.
Yeah.
We are about looking after people.
Yeah. So if I had to coach a dentist on the neurology of a visit, I would say that from the moment they move into reception, the hearing needs to switch on. So there's got to be relaxing music there. Your receptionist needs to be engaging. They mustn't sit down and look at a book. They must get up. They must greet the person, because touch is critical at that time. So there's moments of touch that needs to happen. When you greet the patient as they're coming in, hand on their shoulder appropriately, welcoming them, eye contact is critical, and welcoming in your tonality of voice, because that's also where they pick it up. And the mental preparation of a dentist specialist who's going to work with the patient is, I look at the file, I look at the x-rays, I know what I'm going to do technically. But if I don't touch a patient on the shoulder or greet them by the hand and say, good morning, how are you? And keep them standing and going, so I'd like you to relax and just breathe with me. Let's just breathe together. And let's have 3 lacquer deep breaths. And so here you are. So using that statement, so here you are, brings the mind into the present. So here I am. My goodness, here I am. Here's the chair. Here's all the...
Does that help to
calm them?
Calm them.
Yeah.
And to push the negative memories and
the amygdala is switching on.
All
inhibitor neurotransmitters are switching on, and they're going, run away.
And so this helps
it just helps you. And the breathing is the critical part of that.
Yes.
And so you also need to initiate breathing while you're doing whatever you're doing with the patient in their mouth. Music needs to come in. You can have a little fountain of water bubbling in the backdrop with a little plant somewhere. So it just goes, I'm not coming into this clinical, and I don't know whether a plant and flowing water will be allowed in this clinical space, but music definitely.
Yes.
My mentor, who is a neuroimmunologist, a Jewish neurosurgeon, he does some operations on the brain where they're literally brain dead. They're only living on machines. So they're dead. They're scientifically dead. It's just machines that keep it. And then they operate. And he's had cases where patients, when he comes to visit them after the operation, go, I don't like Western music. And he plays Western music.
So and
under anesthetic. So the question is, what's bigger than the brain?
Yes.
Is your consciousness.
Yes.
And your consciousness is not just contained in the space of your brain. My magnetic resonance is happening 4 meters around me. Your magnetic resonance, that's why we click. is because of the electromagnetic resonance that's happening. And that has been measured by Harvard, where they've taken a person, watched a horror movie, they've taken red blood cells, and they go 11 kilometers down the road, and they watch the horror movie and what it's doing to the molecules and the cells 11 kilometers away.
So they took blood from the patient or from the test subject, took the blood 11 kilometers away, and the blood cells were reacting
to the movie that they're watching in this room
11 kilometers away.
Yeah.
Well, that's
so we are far more interconnected than we actually know or believe, you know. So now coming back to the experience is allowing the patient, when their head is back, to relax, the mouth massaging around here every now and again, and the dentist must do that. The dentist must go, just allow me just to massage here, put the fingertips there in the joints and just relax there. So just move your jaw up and down a little bit, slightly breathe in and out. Are you okay? The language of meaning and the vestibular language has got a few purposes within it. The vestibular is direction, movement, pacing, timing. So in the backdrop of the neurology, the questions is being asked by the neurology. How long? Yes. How far are we with this? So the dentist needs to update the person every now and again, going, give me another 2 or 3 minutes. I just need to do this. This is part of the procedure. I'm now going to do this with you. That's going to take so much. You're going to feel cold air at the moment. Relax it. Breathe in. Get ready for it. Remind yourself that it's going to do whatever it needs to do. We need to dry the tooth on the inside before we put whatever in it. And so you explain what needs to be done. A friend of mine had to go for his third heart surgery, and he was one of my mentors in neuroscience. And he said, you've got to talk to me because I'm already triggering and I'm scared and whatever. So I counseled him and worked with him and found that he was very visual, but he was also kinesthetic, and he needed cognitive input. So I said, what you need to do is take a piece of paper, draw a body, put that in front of the doctor and tell the doctor, here's a pen, take me through the procedure. And I want you to tell me from step 1 what you're going to do. The doctor refused. He said, if you don't do it, I'm not going to have the operation. And the doctor said, fine. So he drew and he said, we can first of all put you to sleep. We're going to tell you to count to 10, but you won't get to 3. We know that. Yes. And you'll be in la la land. And then from that point on, the team moves in. What you didn't see over there was a stainless steel saw that we're then going to open up your sternum, and we're going to cut it open. Then we're going to put a clamp in. We're going to open it up about 11 centimeters or 12. We'll possibly...
My triggers are starting to be highly activated just by the discussion that's taking place.
And the guy says, do you want me to go on? He said, I want you to go on. And he says, then we open up so we can get to your heart. We'll possibly have 4 cracks as 4 ribs break at that moment. And then we're going to cut, and he says, I'm going to get to your heart. I'm going to put my hand under your heart, tilt it. We're going to clamp 2 arteries, and then I'm going, and Armand said, stop. And then Armand made a fist, and he reached across to the doctor, and he said, I want you to hold my fist like you're holding my heart. So I want you to hold my fist. Do that. I want you to, as a doctor would hold it, as you're going to hold it in the theater. And he closed his eyes and he said, I want you to relax and hold my heart exactly like you're going to hold it in that moment. And Armand, with his eyes closed, burst into tears. The doctor cried, and he said, what's going on? What's going on? And he said, doctor, if that's how you hold my heart when I'm unconscious, you can do the operation. Don't need to go any further. And so when I coach executives, my question always is, how the hell do you hold the heart of your customer? And that's a moment of where I put my full trust in. In fact, I'm on the table and I'm not there. I'm really not there. I'm in a conscious level out of my body. So it's in like a pre-state of death. That's why people can come out of that operation that my mentor does and say to him, I hated your Western music, and I also didn't appreciate the way that you spoke to the sister and shouted at her because she gave you the wrong instrument. Where was the person? Another person told him, my mom and dad were in the chapel and I heard them praying. And I went to them and stood next to them in the chapel going, it's okay. I put my hand on their shoulders and said, I'm fine. I'm in good hands. So our living consciousness lives on. I mean, we don't even know everything that's happening in we're not just confined in our biology. Our consciousness is not just confined within the brain and 4 meters beyond us.
Well, I'm
Sure.
completely, yeah. I mean, I almost burst into tears. We so understand that we're dealing daily with people, with people's lives, with their brains, with their hearts, with their teeth, but with the very essence of who they are.
Yeah.
And it's a very real situation. And the way that you unpacked it and explained it based on how your friend actually went through it is just phenomenal.
Yeah.
And I would really urge every medical practitioner and dental practitioner, every physiotherapist, in fact, any health professional.
We need to have a course
to actually just listen to what you've said, because it is just profound.
Yeah. So a dentist can, just like any other medical practitioner, I mean, I'm going into minimal surgery on Monday, and it's a daycare, so I'm in and out, and it's a minor thing, but to me it's a major thing, and so I'm going to have to tell the anaesthetist, you need to give that oxygen mask to me now, and I'm going to put it over my nose and mouth, because the last time I was in the theater and they pumped that thing on me, I went mad. I just had a claustrophobic moment that I grabbed hold of the sister and I said, take it off me. I'm going to break your hand. Take it off me.
And this is what's so critical, Bill, when people interact, when a patient and a professional interact, there are emotions on both sides, because the last thing that we want is a patient that is not comfortable. We want our patients to be safe. We want them to be comfortable. We want to be able to get them into a situation where their health is improved.
Yeah.
And so unbeknowingly, the anaesthetist actually, which would have been standard operating procedure, or the anesthetic sister would have placed the mask over your mouth and nose. But for you, that was an absolute trigger. And the fear that it aroused in you would have had an equal and opposite effect in them as well. They must have been completely traumatized and devastated.
Yeah, I mean, it got to the point where the anaesthetist said, your heart rate and whatever, we can't do. It was going to be a minor operation on a skin graft in my ear.
Yeah.
And the doctor had already told me that he's going to do it. He can do it locally, but I must come in for theatre for some reason. And I've been at an operation before and didn't have that effect. But what triggered me that day, I don't know what it was. It was just some memory way back that decided I'm now coming to the party.
So this wasn't even a memory of a similar circumstance, because you never had that.
That
before.
memory, when I did reflection, that memory was when I was in the fire brigade, and we did diving, scuba diving.
Yes.
And they closed off the tank as part of the exercise, and I went, and I walked on the water. In the next moment, I climbed out of that water, and it was, so I've always got I joke with God, and I go, please, when I die, I want to go
And you want to
I
exhale.
want to exhale when I die. If you want me stressed in heaven, go, that I don't want to die like that.
I so understand what you're saying. We were busy with our search and rescue certification, and part of it was actually unbeknowingly at some stage having your air closed off. And it is just you.
Not a good moment.
Yeah, breathing becomes so labored, and then
there's nothing.
And then there's nothing. And you suck. And you suck. And there's absolutely no air coming out at all.
Yeah.
And it is a very scary moment. So one has to be well prepared. And again, preparation in terms of the coaching, the training, which is how you have not only helped us today and all of the health professionals who are watching and who are going to watch, but how you would coach people to overcome their fear of dental or medical visits.
So coming in, I would offer maybe a lemon tea, just a half little cup of lemon tea. Drink that.
Why is there lemon tea, if I may ask?
Lemon, you want to counteract the acidity in the mouth. So lemon actually counteracts the acidity if you drink it fast.
Yes.
And then it goes through. And the warmth just makes that warm, fuzzy feeling.
Yeah.
You get the person to sit down. You're going, so tell me if you could tell me in 3 short things, what are 3 things that you're thinking right now? I'd love to hear what you're thinking. And you sit facing the patient. And the person will say, well, I'm thinking I'm going to have a tooth drilled and I'm a bit worried and nervous about that, and going, okay, so on a level of 1 to 5, how worried are you? Going, okay, great. So, could I invite you just to close your eyes and find your happy place and go there and just breathe in and out? And
that's breathing in and out 3 times.
Yeah,
is that
3
correct?
times.
It's
Good,
3 times.
A good in and out. They must feel the air going through their nose, coming out of their mouth. And then they relax and they go, stay there. In actual fact, I want to invite you to go there whenever you are sensing tension. Just go breathing and relaxing, breathing and relaxing. Another thing you can do is if you tense and you do crunch your toes, crunch them then really hard, intentionally. Breathe in and breathe out and release your toes.
Yes.
So that there's the biology must feel the release of energy. And the clocking in every now and again, going, I'm busy with this and I'm busy with that. While I'm doing that, just take a breath. Would you like to rinse your mouth out, or if it's possible, etc.? That needs to be done. So maybe a little bit of warm water in the rinsing would add a little bit of value, just so that there's a difference in the cool temperature in the room and the warmth in the mouth.
It's actually so interesting that with modern technology that is available and which we're so privileged to be able to use, the water is now heated. So even the water that comes through the turbine is actually warm water. It's comforting water.
Yeah.
It's not cold water, which would precipitate more sensitivity from the tooth nerves that are already sensitive. So the 3-in-1 syringe that the dentist uses to dry the tooth and to rinse the tooth, that is warm air and warm water.
Yeah.
So I hope that what we have these days is significantly better than what we had before. Yeah. And the water that you rinse your mouth with, the water that washes the spittoon, is warmed.
Yeah, wonderful.
So it's just to create that sensation.
No, you're doing it right.
Comfort.
You're getting 10 out of 10 for that one, Doctor. High five.
Well,
Good shot.
Is the manufacturers of the equipment these days.
So the brain comes into the dentist chair, the consciousness comes into the dentist, and so does the person's past. It's all there in that moment. Boom, there it is. And so we want to be able to don't do positive psychology, which is don't worry.
No.
That's toxic positivity.
Yes.
Every cloud has got a silver lining. I'm going, every cloud has got a lightning bolt in it. So don't tell me it's got a positive thing. So people use toxic positivity, and you can read it up on Google. You need to state reality, but you also need to state it with a sense of hope. So relax, you're in good hands. You need to tell the patient, I know what I'm doing, and here's what I'm going to do. We're going to pay attention to this and attention to that. And you don't need to give all the Latin names of what's happening. You just need to go, this is what's going to happen. We're going to pay attention to that, and then off we go. And then relax, stop halfway, do a little bit of a massage, get the person to loosen their shoulders, relax.
While we're talking about the relaxing and the moving of the toes and the gentle massaging of the muscles, does that help everybody? Would some people prefer not to have their jaws massaged from a neuroplastic and...
Yeah, no, so that you discover in the moment. So some people, you can use your 3 fingers and just go flat here, and just tell the person, you come and do that from the front. You look into their eyes, say, close your eyes and just breathe in and relax. Open your jaw, close your jaw, open your jaw. And if you feel tension here, it could be just nervous tension, and then you go, okay, fine. What does it feel like? Or get the person to take both their hands and go, I'd like you to take your hand and do a figure of 8 on your forehead, and then come to your temples and do a figure of 8 over here. So they can then massage themselves. The moment you feel they're uncomfortable with someone else doing it, then they do it. They can put their hands on their own shoulders, cross themselves, feel comfortable. I want you to hug yourself and know I'm in a safe space. So I'd like you to breathe in and just breathe out and just hug yourself, that you feel I'm in good hands, I'm comforted, this is a good day.
Absolutely.
I don't say...
And it is critical. It is critical to have your dental issues and any other health issues attended to as soon as possible.
Yeah.
Because early diagnosis means treatment can be initiated correctly, which means the consequences and the complications which will arise with time are less.
So you can coach a person by hugging themselves and go, I want you to close your eyes and say to yourself, this is a good day. I'm loving myself because I'm paying attention to my dental health.
Yes. Or my medical health, wherever they may find themselves. Yeah. And attending to our health issues can only lead to better performance, whether it be at home, at the office, on the athletic track, on the bicycle, wherever you find yourself, because you're just healthy. And so you can function optimally.
Yeah. So that's why affirmations don't work, because affirmations need to feel the energy in the body. So if you say every day and everywhere I'm getting better, the energy in the body goes, I don't believe that energy.
I don't believe that.
It's like ba 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 ba. But so I embrace the fear of I'm in the dentist chair, I'm in the doctor, I'm on the operating table. I embrace that fear. I breathe in and I say to the fear, thank you for giving me the message, because I'm now using you to say this. I need to be here because I love myself. So fear, thank you for the warning, but just go backstage now.
Yes.
And now I'm practicing self-love. I'm practicing it's critical for me to have my dental health paid attention to, because all sorts of stuff can happen. I can get poison and toxin, bacteria, that goes into every blood cell, that goes to every organ in the body. So whatever happens in the mouth goes to every organ in the body. So I want to be able to make sure that my oral health is focused on well-being, rather than my oral health being, I've brushed my teeth and that's good enough. It's not.
Which it isn't.
It isn't.
Something that really makes a big difference for our patients that have extreme phobias in terms of dental anxiety and dental fear is intravenous sedation. So with intravenous sedation, we get an anesthetist who comes into the setting, and they then put up an IV line and they then medicate the patient according to the patient's specific requirements, according to our requirements for the procedure. And that enables the patient to be completely relaxed, which means then that we can work in safety and confidence, knowing that the patient is completely safe, completely comfortable, and we are able to treat whatever needs to be done. So we make use of intravenous sedation where the patients do not or have not had access to coaching, for example, from you to get over that extreme phobia.
Yeah. And even in that moment, you can say, the specialist, call them a specialist, is going to put an intravenous and it's going to help you to relax. So I'd like you to go to a place where you relax.
Yes, a happy
in your
place.
Garden.
Yeah.
Where is it? Where do you relax?
Yes.
On a mountaintop, at a seaside, where is it where you relax?
Yes.
And then I want you just to invite that relaxing feeling and breathe it in. So then you breathe in, and then I want you to say, feel it in your shoulders and breathe it out. Then you take a deeper breathe in, feel it around your heart and your chest, and breathe out. Breathe in, take a deeper, feel it around your belly and into your hips. Breathe in, feel it going down all your legs, right down to your toes. Crunch your toes and feel it there, and breathe out and relax your toes. So you are orchestrating through cognitive coaching for neurology to awaken in a state of relaxation. So it's almost that you're getting the neurology to get the person into a trance-like state, which is one of the brain waves. So you need to get them to go there and let them go with the flow. You got the procedure, it's going to help them, but make them consciously aware.
Yes. We know without a doubt that bacterial plaque that is left in our mouths with time changes from bacterial plaque that is not that pathogenic or dangerous. The bacterial population shifts and changes to a bacterial population that is very dangerous to your teeth and to the supporting structures, the gum, the periodontal ligament, and the bone around the teeth.
And that eventually goes into the bloodstream,
Yes.
right?
Now, what is so interesting is that according to current research, that a patient who has minor ulceration, these are microscopic ulcerations of the gum, underneath the gum, around the tooth, that ulceration in periodontal disease, advanced periodontal disease.
That's like when the gum is red, right?
When the gum is red, when it's swollen, if you notice spaces that are happening between your teeth where there were no spaces, if you notice that teeth are becoming a little bit loose, if there's bleeding when you brush or floss, those are all signs that periodontal disease could be starting or in fact getting worse. If you put all of those ulcerations together, they say that those micro ulcerations would be the size of your hand. That means that the bacteria and the inflammatory products enter directly through that ulcerated area into the blood vessels, which are around the teeth in the mouth. And those blood vessels are obviously connected with the blood vessels of the entire body. What happens when those bacteria and inflammatory markers get to the brain?
Well, it first of all goes into the blood. So
Yes.
It gets through the blood. The moment it's in the blood, it immediately affects, so you get inflammation, factors that happen within the blood, and inflammation is the invitation to cholesterol. And then you get red blood cells that instead of our little circles that are floating around, they join together and they become like this, looks like a snake in the blood. And so they just congeal together. So that's the effect of inflammation. You'll pick it up with there. And then the bacteria are little black spots in the blood that actually dance around. You actually see a little bacteria dancing around in the blood. And then that blood and bacteria goes up into the heart. From the heart, it goes to every other organ in the body. So it lands up in the brain. And that inflammation.
So this is critical, is that bacteria from the mouth, as well as the inflammatory markers and the inflammatory products and the inflammatory cells, get into the bloodstream. They go to the heart, and then they are disseminated not only to every organ, but basically to every cell, including our skin.
Absolutely.
Yes.
Yeah. So the skin tags and all of that, it's a blood problem. There's something that's in the blood. And the biggest issue that we have to tell people in their general health is to get your pH in your body right.
Yes.
So they need to go and get a litmus test. And the moment they've got the litmus test, they need to get to a homeopath so that they can sort that lot out. So
this is a critical factor in the mouth. We have two phases. The one is remineralization, where the teeth have the capacity to be healed because they are remineralizing.
Okay.
And then we have demineralization, which is where the minerals are actually leached or pulled out of the covering of the tooth, the hard part, the enamel. Once that demineralization gets into the dentine, the tooth cannot heal itself. You then need to see your dentist to get it basically drilled and filled.
Yeah.
Critical. So
and build.
I was waiting for that. I was waiting for that.
Yeah, my name is Bill Price, so you get the invoice with me.
Now,
okay.
What is so interesting is that the saliva not only washes the bacteria away that are in our mouths, but it buffers the acids that are produced by the bacteria that are feeding on the sugars. So we have sugars, we have carbohydrates in the mouth. The bacteria utilize those sugars. They produce acids. The acids take the remineralization to the demineralization. It starts with a microscopic defect on the tooth, on the weakest part of the tooth. It always does. It looks for the weakest part. And then it progresses with time. So we need to make sure that our mouths are always adequately moist in terms of having sufficient saliva. We need to keep the bacterial populations under control.
And then we do keep it alkaline.
And that we keep it alkaline and not acidic.
Yeah.
And this is a problem where people who really like, for example, lemons the whole time in their water, because what's happening is you're adding more acids. Our athletes are at great risk because the sports drinks are generally a lower pH, acidic. They are full of sugars. The bars, the gels, the goos are all highly sticky and adhere to the tooth surface and are obviously full of the carbohydrates, the sugars that we need for refueling. So we have bacteria that can't be washed away. We have breakdown products that cannot be neutralized. And we're just feeding them sugar the whole day. Yeah. It's like nuclear war. And that's why it's important to brush properly with a soft brush correctly. So you need to make sure that you know the correct brushing technique by seeing your dentist and your oral hygienist regularly. Oh, and by the way, contrary to popular belief, there's no set program for how often you need to have your teeth cleaned. It really is how often do you need to have your tires changed on your car. Everyone needs a customized program.
Yeah, wow, that's interesting.
Yeah, because some people maintain their oral hygiene and their health generally so well, and with time their dentist could say to them, okay, I could see you every 6 months. But we have other patients where we need to help them on a monthly basis.
Yeah. So taking to close off, to take the inflammation and the bacteria that goes into the blood, into the brain, eventually over a period of time, you get enough of it in there, then that inflammation can trigger off an epicenter of Alzheimer's disease, dementia, strokes, the beginning of an invitation party to a stroke, and all sorts of other scary stuff that goes, memory loss and all of that. So, yeah, it's not good when the dance between inflammation, biology, and neurology, when they all dance together, they all come to the party and they're all impacted.
Yes. And this correlation between dental health and systemic health has been well researched.
Absolutely.
Especially by the periodontal organizations. And I know that it was Professor Andy Huberman who was talking about recent research, and I'm not sure if it was done from Stanford, but he spoke about it on one of his podcasts, where they've actually are now proposing that the bacteria from the mouth crosses the blood-brain barrier and is now thought to be involved in the precipitation of Alzheimer's disease as well.
Yeah, no, absolutely. Yeah. So the research, and thank goodness for it, that's we're moving from what I don't know to what I should know, which is a lovely gap. But it's been wonderful chatting to you. I feel so relaxed. You can go ahead and take all my teeth out now.
No, that is not how we will operate today. But I must say that not only did I enjoy spending the time with you, but the time has flown. We haven't got to do any dentistry. But I must say that I feel enlightened and I feel quite relaxed.
Yeah.
Just by watching you do the breathing exercises. So
and
really,
at some stage, we'd love to be able to make available an opportunity, maybe a workshop for dental workers and dental health practitioners, to talk a little bit about the neurology and the conscious mind around the whole visit from both sides.
So how would they be able to contact you then in terms of
they can contact my email is bill.price@me.com. Okay. So it's my name with me in it and an @ and a .com in it.
That's a very, very interesting email, because it's really about talking about that I'm really comfortable with myself. Won't you just unpack that one again for me?
It's Bill.Price, full stop, Price, my surname, @ me.com. So Bill Price is the name. It comes together in me. That's my identity.
Yes.
And .com is where you find me on the space post box.
Fantastic. Well, thank you so much.
Thank you.
I really appreciate it.
It's lovely talking to someone who is so passionate about oral health, and I'm so thrilled that I'm part of the process, small part of the process, to get the message out there.
Thank you so much.
Thank you.
Paul. Thank you for your time. We really want to thank you for taking this time to spend with us, because it has been a fascinating time and an enlightening time in terms of understanding that wherever we go, that this comes with us, that it is an intricate part of everybody, and that we can never isolate one part of the body from the rest of the body. So thank you for spending your valuable time with us.